Okay, I'm doing another one on strep. And since I went so long without without doing them, I kind of want to do another one on constipation next. I think I will. Um, get it all done while the kids are at school, right? So I wanted to talk about strep throat. I hear it. I hear it a lot. Strep's going around school. Every time I have these symptoms, I know it's strep. I need to have my tonsils taken out, so I'll stop getting strep as often. Those kind of things, like we're always kind of hearing. So don't throw rocks. I'm just sharing your friendly pediatric emergency mom knowledge. Um, Believe it or not, if you have nasal congestion, cough, all the upper respiratory stuff that we're seeing all the time, you probably don't have strep. So a small percentage of people who do have strep pharyngitis, so strep throat, do have the nasal congestion, the cough, all of that stuff as well. But the vast majority, if you have strep throat, your symptoms will likely be headache, sore throat, fever, and belly pain. Those are the most common symptoms of strep throat. Occasionally, you'll see a fine kind of sandpaper-like rash is how it's described all over the body. And if you have that, then that's scarlet fever. So think like strep throat with a rash. So let's just talk about when to even test for strep throat. There are some clinical criteria we look for on a physical examination. And I won't go into all of that, but one of the main things that we see in strep throat is if you have those little red dots, like little pinpoint red dots in the very back of your soft palate and on your uvula, then you can certainly have that in viruses, but it is a pretty strong indicator of strep. So again, believe it or not, and don't throw rocks, we treat, so strep pharyngitis is actually a self-limited illness. So it could go away on its own, 5 to 7 days, it could go away on its own, but we treat it to prevent rheumatic fever. And the, rheumatic fever from long ago can cause some serious heart problems. We, thank goodness, really don't see it much anymore because we treat strep. But if you are less than, so to mount the response to develop rheumatic fever, you have to have certain conditions present within the throat environment. And so if you're younger than age 2, you don't really have that. It's the older kids and the adults that have that better kind of environment for strep to progress to rheumatic fever. And so then going back to antibiotics and antibiotic use and antibiotic resistance, and limiting how often we're treating with antibiotics, just thinking broad and big picture, our question becomes, if they're less than 2, why are we even testing? If you're positive for strep and you're a 1-year-old, do you treat with antibiotics? I mean, truthfully, sorry, that was me, not Ladybug. We're not even testing. We go by the Red Book, which is an infectious disease book, and CDC recommendations. And so in the ER, we don't even test if they're less than 2. And some people say less than 3. And that's, we do see that pretty often, that people are testing 2 and 3-month-olds for strep and treating with antibiotics for strep. And I got to tell y'all, that's just not foundation. The other thing with strep the tonsils, taking your tonsils out. Tonsils are glands, right? Like you can get swollen lymph nodes in your neck. You can get them anywhere. And so that's what tonsils are. Tonsils are lymph tissue. They're tissue that drains infection, and present in your throat. If you get your tonsils out, you could still get strep. And I'll be honest, some people can develop tonsillar tissue again, maybe not as big as you have when your native tonsils, but they can develop it again. You can still get the sore throats. You can still get strep. So it may help some people, but it may not be a curative measure. And to say I'll never get strep again or I'll never get sore throat again, that's not necessarily. Strep is very painful. In my other live, we talked about steroids, and if a kid is having severe throat pain to the point that they won't swallow, then that would be a time, talked about, that's one of those times when you may want to do steroids, like 1 dose of Decadron to help with the pain, to be able to keep them hydrated. Strep is one of the few things we can still use plain old penicillin for. There aren't many things that we can use just penicillin for, but that is one of the few things we can use it for. So your kid's not going to like it if they get a shot, but it's one time and it's done. And then they won't need antibiotics after that. Then we can get into the complexity of a strep test. So remember we talked about if your immune system is busy tackling one thing, so you have a strep, your immune system's busy tackling that, you get your shot of penicillin or you get put on amoxicillin for a week, and then in recovering from the strep, you pick up cough, cold, and congestion, a virus from going to school. I'm saying you, I'm talking about kids. And then your throat hurts and is red because you have this congestion dripping on the back of your throat at night. If you go back into your doctor's office, if they swab you for strep and your test is positive, do you still have strep or is it just a positive test? So then we talk about positive in disease versus a positive test. So we see this in the ER sometimes as well. I got treated with a week of antibiotics for strep, and then my throat was still red, and they tested again, and it was still positive, and so now I'm on the second round of antibiotics. And again, that strep is self-limited. So if you've been on your course of antibiotics or if you've gotten your shot, then it should be done. There are certainly complications from throat infections, and again, right, this is just my sharing my information with you guys. I do not take the place of your physician. You still need to see your physician, need to get examined. If little kids are having severe throat pain and can't turn their head, that's serious and needs to be looked at as soon as possible. If older kids are complaining of one side hurts more than the other, and maybe you look in their mouth and one tonsil is kind of pushed forward, that's a problem as well. So we do see complications from throat infections, and you can, hey Alyssa, yes, I will do that. She wants to know if I'll talk about urinary tract infection in kids. Yes, I'll add a list. So while it may seem like your doctor's saying, oh, it's just a throat infection, it's no big deal, we're not. I mean, we are taking it seriously. We are making sure that we're doing everything we need to do and looking as well as we can to make sure we're not missing anything else. And so, if, again, like anything else, we can't tell the future. So I don't know what's going to happen when I see a patient. I don't know what's going to happen to them in 12 hours or 24, 48 hours. So if anything changes, then it's certainly important to contact your physician, go to the ER, whatever it is you feel is appropriate. But that's just a little information on strep and what I usually tell parents. I hope it's helpful. Thank you guys for supporting the site. It's really grown. It's like 1,600 now, which is great, and I'm happy to keep sharing this information. I may put a poll up, or I don't know. Y'all know I'm technologically challenged, but I'm thinking about doing like a website with kind of some online courses. I feel like in this day and age, when you need information, you kind of need it now, and you don't want to read through a bunch of things. And so I made there really great informational sites for kids when they're well and normal and all of those things, but I don't know how many sites there are when kids are sick. And so I was thinking about creating a website and kind of doing that. Anyway, so I'd appreciate any feedback. Thanks, you guys. I will see you at my next live.